right, we are recording and I'm going to start the webinar now.
Okay, it just says that I can't start my video, which isn't a big deal. I don't need to turn it on, but
that's fine. We don't need your video. You're good. Okay. Yeah. All right. So we're gonna just, people should start coming in, and then at exactly on the hour, I will introduce you. Okay.
Mm-hmm.
Hello, everyone, and welcome to day 2 of the Quality Management Systems course launched by Pathologists Overseas and ASCP. We're very happy to bring you this course. We're going to give people just a minute or two to come in, so we're going to start in 1 minute. All right. Hello, everybody. My name is Dan Milner. I'm the Chief Medical Officer of the American Society for Clinical Pathology. And on behalf of Pathologists Overseas and ASCP, we're very excited to bring you this Quality Management Systems course. We are now on day 2 of the course, and our speaker is Kristen Murphy, who is a medical laboratory scientist, and she will be discussing process control, sample management, and quality control for the introduction. She's also going to do a case review at the end. The format will be, if you have a question, please put that question in the Q&A box, which you can see at the bottom of your screen. Just click on Q&A and you can add any questions you like there. Do not use the chat function unless you have a technical problem. We don't need you to answer questions in the chat or put anything in the chat except you're having a technical problem, and we will try to help you with that. But if you are asking a question of the speaker, use the Q&A box. After the presentation, Kristen will answer as many of the Q&A questions as possible. Then she'll do the CP case review and answer additional questions, and then we'll conclude. And I just want to remind everyone that you should get a registration link on Sunday for next Tuesday's session. You will need to go and register for that link to get the Zoom, and also the case that will be discussed next Tuesday is included in that link. And again, that should come to you on Sunday. Check your junk folder or your spam folder if you're not seeing it. So with that, I'm going to turn it over to Kristen.
Thank you. Hi, everyone. Thanks so much for having me. My name is Kristen. I'm an ASCP certified medical lab scientist from the US. I spent about 5 years working in various clinical labs in the US in different departments such as hematology, chemistry, microbiology, and blood bank. And then I spent about 2 years working in a clinical research lab in Kampala, Uganda that focused on research of malaria and sickle cell disease in children. And I'm currently in the process of pursuing a master's degree in control of infectious diseases at the London School of Hygiene and Tropical Medicine. So that's just a little bit about me. I'm very happy to be here today with you all. So the overview for today's session, broken into 3 parts. First we'll talk about sample management, and that'll be the bulk of the presentation. And then we'll talk just briefly about QC, just a little bit of an introduction, and then we'll review the case study that you all have received and hopefully have had some time to work through. So just a note for the QC session, it's really just meant to be kind of a really brief introduction. It won't go into a lot of detail, but you will have much more in-depth sessions on QC later in the course. So the first part is on sample management. And here are the learning objectives. By the end of this presentation, you should be able to name sample collection errors that could lead to incorrect laboratory examination results, list contents that should be included in a handbook designed for people who collect samples, provide a rationale for rejecting unsatisfactory samples, describe a system for sample handling, including in collection, transport, storage, and disposal, and explain the importance of maintaining sample integrity and assuring that all regulations and requirements are met when transporting samples. So here you can see the 12 components of the quality management system, which you talked about a little bit on Tuesday. So today's topic of sample management and QC is part of the process control component, which you see here in the circle in the middle with the white square around it. So first, a really important concept to understand and remember is that any lab examination is really only as good as the sample that is received in the laboratory. So the quality of the lab, the quality that the lab produces really depends on the quality of the sample that it uses for testing. So any lab has to be really proactive about ensuring that samples are the samples that are received meet all of the requirements needed to produce accurate results. So thinking back to Tuesday's presentation, you talked about how the majority of errors actually take place in the pre-analytic stage. So sample collection, sample receipt, and processing is a really crucial part of the pre-analytical phase. And it's really important that a lot of time and effort is put into making sure samples are the best quality before testing begins. So just as a kind of metaphor here, you can see the pictures of the eggs on the screen. So thinking about this, you can't take a broken egg and make it whole again, right? Like you can't have a broken eggshell and turn it into a whole and complete egg. So in the same regard, you can't take a specimen that was improperly collected or labeled and expect it to perform at the same quality as a properly collected sample. So good sample management is critical to the accuracy and reliability of testing, and therefore to the confidence in laboratory diagnosis. Laboratory results directly influence therapeutic decisions and have a significant impact on patient care and outcomes. It's important to provide accurate lab results in order to assure good treatment. So our role in the lab is so important, whether it's in a clinical lab or a research lab. And it's important to always think about the effect on patient care, because at the end of the day, that's really what we're all here for. It's for the patients. So inaccuracies in testing can impact things like the length of hospital stays, as well as hospital and laboratory costs. So inaccuracies can affect laboratory efficiency and lead to repeat testing, which results in waste of personnel time, supplies, and reagents. So there are a lot of downstream effects that can be seen with inaccurate results as a result of poor sample management. So what are some of the ways that we can ensure good quality specimens and some tools that we can use to ensure good sample management? Well, one of the tools is the laboratory handbook. So a lab handbook contains the written policies for sample management that have been established. So the first step is to establish these policies. As a lab, think about what are the requirements for the services we offer. And then you need to really well document those requirements in the lab handbook. So this should contain information that is needed by those who collect the samples and should be available at all sample collection areas, and it has to be understood by the lab staff so that they can be available to answer questions. So this is a really helpful tool because in the lab, we want everything to be standardized, right? We want everything to be done in the exact same way every time so that no one has to guess on the correct way to do something and we don't have variability in the way things are done. So the lab handbook puts all the useful information all in one place and puts all the necessary information in an accessible place for the people that need it. So the things that could be included in the lab handbook are information needed on test requisitions, handling of urgent requests, collection, labeling, preservation, and transport, safety practices. This can include, how to handle leaking or broken containers, contaminated forms, other biohazards, evaluating, processing, and tracking samples, and storage, retention, and disposal. So we're going to talk about these in more detail. So, and where you keep this lab handbook is really going to depend on your unique circumstances. It could be in the phlebotomy area of an outpatient clinic. Maybe it's on the ward of a hospital. Maybe it's with the community healthcare workers of a study. Maybe you have an electronic database that you can put it on that can be accessed by people in many locations. But you really just need to think about who needs access to information and then make sure that the handbook is available to those people that need it. So what should it contain? Some of the things that it should contain are the name and address of the laboratory, as well as the contact names and telephone numbers for essential personnel. The hours of operation of the laboratory that can be helpful for setting expectations for when the lab is open. A list of tests that can be ordered. The sample collection procedures, so detailed information on sample collection requirements for those tests, sample transport requirements, the expected turnaround time, and a description of how urgent samples are handled. This should include a list of what kinds of tests are done on an urgent basis and what the expected turnaround times are and how to order urgent requests. And now, again, not all of these things may be relevant for your particular situation. Labs have a huge variety. There's clinical, there's pathology, there's research labs, and they all will have kind of slightly different requirements. But the purpose of the lab handbook is universal, and it makes it a really easy place for non-lab staff to go to understand what is expected of them and what you are, as a lab, are expecting them to do. So another thing to keep in mind for this document is that it really needs to be kept up to date. And this can be challenging, especially if things are changing quickly or if you're just starting off and a lot of changes are being made. But it's really important to constantly review this document and keep it up to date, because that way, people don't expect people to just remember every little change that's made. If you give them this resource and keep it up to date, it'll be a really helpful place for them to go to have all of the information in one spot. So thinking a little more about the laboratory's responsibilities. So what are the lab's responsibilities? Well, some of those are to provide sample collection information, such as what, when, and how of sample collection, provide appropriate containers and supplies, define a good labeling system, and to assess all samples. So pre-examination, making sure that you're assessing all samples. Again, and this is all really part of the pre-analytical phase. So the laboratory should periodically provide training sessions to healthcare and laboratory personnel who are responsible for collection of samples. And I can't stress enough how important it is to have really good communication and good training between different areas of the healthcare settings. You know, the labs, the doctors, the nurses, phlebotomists, everyone needs to really work together on this. And a lot of times people may think that, oh, sample collection, that's the nurse's job, that's the doctor's job. And I don't have any control over it, or I don't have any responsibility there. But really, the samples that we receive in the lab, it's our job to ensure that we are providing the resources so that those samples that we need are really good quality. So the lab is responsible for the results that we give out, and we can't give out good results without a good sample, and we can't have a good sample without good collection technique. So it's really important to kind of think about kind of the bigger picture and how all of these things are interconnected. And then providing appropriate containers and supplies. That's a really important one. And it's also important to look at things like expiration date. I know, especially for containers that may be less often used, maybe they're not used so often, it can be easy to kind of forget about checking those expiration dates of those storage containers. And for some things, it may not matter. Maybe a sterile urine cup, using it past the expiration date might not be a big deal, but especially containers that have preservatives in it, using it past the expiration date can have an effect on the sample and then the result. So it's really important to keep those things up to date and keep on top of checking those expiration dates. And we're going to talk about labeling additionally in a second. So first, let's talk a little bit about the test requisition. So one of the first steps in the process of obtaining the sample is the request for testing. So again, it's the laboratory's job to make available a test request form that specifies all the information that will be needed. So now what you are going to require and how the requisition is structured is really up to you. That's going to vary from lab to lab. So again, clinical labs, pathology labs, research, field studies, for example, they'll all have different requirements, and what is right for one might not be right for the others. But in general, some of the important information that that should be on the lab rec are the patient ID, such as whether that's the patient's name, or in a study setting, maybe that's the patient's study ID, the test request, so what exactly is being requested, the date and time of sample collection, and this is really important to know because, as we know, the longer things sit, some changes can happen in the sample. And so it's really important to know when exactly that sample was collected. The source of the sample when appropriate. This is especially important for pathology specimens, where was it collected from? Clinical data, if that's relevant or if that's needed for your lab. And then the contact information of the requesting physician or authorized individual. And this can be really helpful, especially when we talk about rejecting samples, or just if anything is unclear or anything needs to be discussed. It's really good to have a contact point that you can discuss those things with. So collection requirements, when we're thinking about collection requirements, these are just some things that would be important to establish and write in your lab handbook. So remember, sample collection and preservations will vary depending on the test and type of sample to be collected. So the lab has to really carefully define a sample collection process for all of the tests that it performs. So some of these things include patient identification. So the person collecting the sample must accurately identify the patient. This could be done by questioning the patient themselves, or possibly questioning the accompanying family member. Maybe if it's a child or someone who's not able to communicate, you can question the guardian or whoever's with the patient. Or also, if they are kind of in an inpatient setting, you can use a wristband or other type of ID. And patient identification is a really, really important and critical step. We will talk more about this when it comes to labeling, but making sure you're collecting the correct sample from the correct patient is extremely important and can have a big effect on patient outcomes. And then patient preparation. So some tests require that a patient be fasting, or there could be special timing issues for tests such as blood glucose or drug levels or hormone tests. So if any of those things are required for the test that you offer, it's really important to list that information. Also, things like blood cultures. Blood cultures have a kind of special preparation cleaning procedure for the skin. So it's really important to clearly communicate that in the lab handbook so that the person performing the collection knows what is required. So the type of sample required. So, we have blood tests. Some blood tests use serum, some use plasma, some use whole blood. And that goes into the type of container that you need. So the purple top, green top, blue top. Don't expect the person collecting the sample to have all of these things memorized. So having it all written out really clearly in a lab handbook will help the person collecting and kind of take the guesswork out of it. And so making it really clear what exactly they need to collect in what type of container for which types of tests. And then also a thing to keep in mind for the container is also the volume. So some tests, some instruments have a minimum volume for a test to be run. Some other kind of manual procedures have volume requirements. So it's really important, if there is a volume requirement, that you make that clear. And then sample labeling. All requirements for labeling of the sample at the time of collection need to be explained in detail in the instructions for collection. So again, making sure that you're making really clear what is expected of the person that is collecting the sample. And then any special handling that might be necessary, such as, does the sample need to be put on ice? Does it need to be protected from light? how long are you expecting to receive it in the lab? Any kind of those special handling instructions should be clearly written down. And then also safety precautions, of course. And then an additional thing to keep in mind, so sometimes patient collects samples themselves. For example, a stool sample for parasitology ID. So in these kinds of situations, it's important that the lab have kind of a separate set protocol to give to the patient themselves to ensure that they feel comfortable collecting the sample. They know exactly what's expected of them. Again, safety precautions is really important. So how are they going to do the collection, how they label their specimen, all of those things. And those instructions, you should think about what language that's going to be in, depending on, if you're in different villages, then you may need to get it translated to different languages, and also accommodating for those who can't read. And so maybe you want to just put pictorials, describing the collection procedures in pictures, so that if someone is not so great at reading, they can still understand what's required of them. So talking a little more about labeling, in general, some of the important requirements for a sample label are going to include the patient's name, patient's unique ID number, the date and time of collection, and the collector's initials. So the collector's initials can be helpful because, again, if there's any problems with the sample, it can be really easy to track down who collected it. But we also realize that, a lot of time these sample collection containers are really tiny, and sometimes it can be difficult to get all of this information on there. And so it's really important as a lab that you kind of set your requirements, and again, make those requirements really clear. Also think about what you're labeling with. If you're handwriting the labels on the tubes or the container, make sure you're using something that's not going to smear or wipe off. Ideally, if possible, computer generated barcodes are really handy, and that kind of eliminates the risk of a label, getting smeared or not being able to read somebody's handwriting. I know that can be a really challenging thing. So just make sure you have your requirements really clearly written, and that you're communicating your expectations to the people that are doing the labeling. If you're having constant problems with someone's handwriting, have a conversation with them. That's where that communication element really comes into play, that you can track these things and discuss and see, how can we improve this? So handwriting can be a really big thing. And so it's really important that the people doing the labeling are paying attention to that. And I know it can be difficult, especially when it comes to patient's date of birth. Sometimes that might not be always known. So if there is another kind of unique identifier that can be used, that's great. But really, again, it's up to the lab to kind of know your population and make your requirements that can be in line with the population that you serve. And then it's also really important to think about when is the labeling being done. So again, this is something that may not be intuitive to someone who doesn't work in the lab, but we know that errors in sample labeling can lead to huge destructive patient outcomes. So we really want to make clear that labeling always needs to be done at the time of collection, right? You never want to kind of walk away from unlabeled samples, because there are so many things that can happen. They can fall on the floor, they can get mixed up, they can a number of things that can happen if you have unlabeled specimens. So as a general rule, you really never want to have unlabeled specimens laying around anywhere. Always take the time to label them at the time of draw after identifying the patient. So thinking about all of the components we just talked about for sample collection, let's just talk through some of the outcomes that improper collection can have. So these can include delays in reporting testing results if you have to kind of spend time on the phone or troubleshooting, figuring out what happened. That can delay the test results. Unnecessary redraws or retests. So especially for children, that can be very dramatic to have to redraw a specimen. It can lead to decreased customer satisfaction, increased costs for the laboratory. And then lastly, and I would argue most important, it can lead to an incorrect diagnosis or treatment, injury, and even death. When you think about, especially blood bank specimens, it's so important that those be collected and labeled appropriately, because giving someone the incorrect blood type, it can have serious consequences. So there are so many kind of downstream effects of improper collection. And this goes back to talking about how the majority of errors happen in the pre-analytical phase, right? So these are all things that happen in the pre-analytical phase that really need a lot of attention to make sure that we're catching those mistakes, or that we can prevent the mistakes from happening in the first place. Okay, so we've now gotten to the point where the sample has been collected, and now we're actually receiving the sample in the lab. So we're still in the pre-analytical phase. So, lots of opportunities for error still. So once a sample enters the lab, there are a number of steps that are needed prior to testing. So these pre-examination steps include verifying the sample is properly labeled, adequate in quantity, in good condition, and appropriate for the test required. The test required must be, the test requisition must be complete, include all of the necessary information. So again, this is the role of the lab, right? This is the laboratory's responsibility to ensure that every sample that is coming through the door, every sample that is being processed is kind of up to your standards. And then the sample should be recorded in a register or a logbook. We'll talk about that more in a second. And then also enforce procedures for handling suboptimal specimens, including sample rejection when necessary. So we're going to talk about that next. So specimen rejection. I know this can be a really tough subject, especially when we're talking about sick patients, we're talking about children. It can be really difficult to reject a specimen and potentially, impact that patient. And but rejection criteria is there for a reason, and sometimes we can make exceptions, and sometimes we can't. So the lab really needs to establish clear rejection criteria and follow them closely. I know it's difficult to reject a sample, but remember that a poor sample will not allow for accurate results. So in some situations, there is just nothing you can do with an incorrectly collected or labeled sample, but sometimes there are things you can do. So we'll talk about that. So it's the responsibility of the lab to enforce its policies on sample rejection so that patient care is not compromised. And then not only, just stating these policies, but it's really important for management to regularly review the number of rejected samples and the reasons for rejection. And that can inform training. So maybe, it's constantly one person is collecting samples and they're just really having a hard time with the procedure. And maybe you need to do some additional training with that person, or maybe your procedure needs to be revised. Maybe your procedure isn't very clear. So constant review of these, how many samples are we rejecting? What kinds of samples are we rejecting? And what are the reasons that we're rejecting them? Constant review of that information can help inform policy change or additional training that's needed. So just for some examples, some of the examples of samples that should be rejected. So unlabeled samples, especially if it's not accompanied by any type of test requisition, this is really something that there's really not a whole lot you can do with an absolutely unlabeled specimen. It's especially if it's not coming with any kind of requisition or anything, that would be kind of an automatic rejection. A broken or leaking tube or container, insufficient patient information. Now that's sometimes maybe something that can be corrected. Sometimes you can call and get that additional information. If the sample label and the patient name on the test requisition don't match, again, that's something that you need to look more into. Hemolyzed samples, depending on the test. Now, some samples, it completely depends on the test method, right? So hemolysis isn't always an automatic cause for rejection, but there are some tests that hemolysis does really interfere with. And maybe you as a lab need to have a policy where, okay, we're not going to reject hemolyzed specimens, but any hemolyzed specimens, we're going to put a note on any of these results so that the provider interpreting these results knows that there was hemolysis and can understand how that may have impacted the test and the test result. So samples that are collected in the wrong tube or container, for example, the wrong preservative, that is something, again, maybe that can be compromised, maybe not. You know, you can't run an EDTA sample, a purple top, on a chemistry analyzer, right? It's just not going to work. So sometimes things like that are cause for automatic rejection. Inadequate volume, like we talked about, sometimes really short samples, there's just not enough for the analyzer to run them. And prolonged transportation time. So some samples, they need to be brought to the laboratory and tested immediately. And if they're left sitting for, you know, a day, 2 days, that can really have a big impact on the test results. So it's really important when rejecting the sample, you need to promptly inform the authorized person that the sample is unsuitable for testing, request another sample, and make sure you emphasize what was done wrong and you know, point them to the lab handbook. And then retain that rejected sample and also really clearly record the reason for rejection. And so that, especially if you need to consult with people to see whether or not it can be run, always keeping good records is good practice. And also just, you know, keep in mind, extraordinary circumstances may require testing suboptimal samples. That's just kind of the nature of the lab, right? Especially really difficult to obtain samples like, you know, CSF or pathology specimens. You really never want to reject those types of specimens. You want to do everything in your power to be able to provide a result and work with the provider. And it may just be a case of you explaining to the provider, you know, this is what we received, this is why it's suboptimal, and this is how it could impact the results. And so maybe you still run it, but you release the results with kind of a note saying that, you know, interpret the results with caution for these reasons. And so that's really up to the lab to establish these criteria, make them very clear, and then enforce them. So now going back to, you know, when the sample is received, so whether or not the sample is acceptable or not, it needs to be logged, right? So every sample that comes through the door needs to be logged in a register. So this can be a manual log, like a paper book that's one that's shown here. Maybe you have a computer system where you log samples in on the computer. So again, different labs will vary. But in general, you need to keep a log of all incoming specimens. So if you want, you can assign, sorry, the register should include things like the date and time of collection, the date and time of receipt, so you can kind of track how long it's taking to get to the lab, the sample type, the patient name, the demographics, if that's required, the laboratory assigned identification. So not every lab may have that policy, but sometimes labs will assign their own laboratory ID or a session number, and then the tests that are requested to be performed on the sample. So that's just an example of things that your sample log should include. And this is really important for organizing and tracking. So it's really important to track every sample that comes through the door. It can give kind of confidence in exactly what came through your door and when. If someone questions, you know, they say, oh, I sent a sample, I didn't get the results back. It's really nice to be able to go back to a really well organized, clearly written log and say, these are exactly the samples that we received today. And the sample that you're mentioning, you know, is not on the list. So it can kind of give you confidence in what exactly you received and help track the patient sample from the time it enters the door through the time, you know, it's disposed of. So sample tracking, there needs to be a clear policy for sample tracking, how exactly this is going to be done. And this needs to be written really clearly. You can do sample tracking either manually or in a computer, depending on, you know, what your lab has set up. But either way, every single person working in the lab needs to be doing the same thing with the samples and make sure everyone is clear on the procedures for how those samples are being tracked. So sorry. So you need to confirm the receipts of samples, again, including the date and time. Label the samples appropriately, keep the samples with the test requisition until a lab ID is assigned, and then track aliquots. Make sure they're traceable to the original sample. That's really important when you're making any kind of sample aliquots, that you're not just putting it into an unlabeled container. Every container needs to be labeled, and it should be really clear when you're making aliquots, what original sample did that aliquot come from. And then lastly, for sample handling, always follow universal precautions. This is kind of lab safety 101, right? You always handle all samples as if infectious. You just never know what's in that sample. You never know what types of infections or diseases could be contracted from handling the sample. So always protect yourself and make sure you're following universal precautions. Safety glasses, lab coat, gloves, all of those things protects you. And it also protects the sample, making sure you're handling them in a kind of, especially like micro samples, you really want to make sure you're handling them using clean gloves, things like that. So protect yourself, protect the sample, always use universal precautions. I know sometimes in labs, especially when things are getting really busy, or maybe if you live in a place that's really warm, it can be really hard to have those lab coats on all day, right? Like sometimes they're really thick and they're heavy material and you can get really hot, but it is important that you are following safety precautions. It's really to protect you more than anything. So don't take any chances and make sure you're handling all samples as if they're infectious. So thinking about sample storage, so now we're at the point where the samples have come in, we've done the testing, and now we're talking about sample storage. So again, there needs to be a written policy for this. The policy should describe the samples to be stored, determine the retention time. So how long are you going to be keeping these samples stored for? Where are you going to be keeping these samples stored? So make sure you write the location. The conditions for storage. So are they frozen? Are they refrigerated, room temperature? All of those things need to be clearly written down in the storage policy. And then establish a method for organizing samples. And it's important to think about ease of access, right? So if these are samples that need to be further used soon, then you'll want to kind of keep them in a way that's like easy to access. Or if there's something that you don't think that you're going to need again, maybe they can go towards the back of the freezer. Whatever the case, make sure you're keeping ease of access in mind, and that there is a clear organization system, and that is actually documented. So again, this is really up to the individual labs to kind of think about what's going to work best for them, how long they need to keep samples. Maybe some samples are only stored for a day, maybe some samples are stored for a week. Whatever the policy is for your lab, make sure you have it documented very clearly, again, to take the guesswork out of anything. And then as far as sample retention, so talking about sample retention, we're talking about kind of more long-term storage here. So it's important to also have a policy for sample retention, especially things you're going to be keeping long-term. Some samples can be quickly discarded, others may need to be retained for longer periods. So it's really important to constantly monitor your stored samples and make sure you're not keeping anything longer than necessary. I know that refrigerators and freezers can get really crowded really quickly. And so constant monitoring can help identify those samples that are no longer needed and free up space. Also, monitoring is really important just to make sure that you have all of your samples accounted for, right? Like if you expect to have 15 boxes, you want to make sure every so often, maybe you do a monthly review, that you have all of the samples that you're expecting. And then additional planning is needed for samples that need to be kind of long-term storage. So we're talking about, maybe a year, maybe longer than a year. So an organized, accessible system. Ideally, if you can kind of have a computer documented method, that would be ideal. And that can be really useful and helpful for these samples. And the inventory of stored samples should be reviewed at specified intervals to determine when they should be discarded. And again, all of these things that we're talking about really need to be documented in a written policy. I know there will be an additional session on kind of document control in the future, but in the lab, everything needs to be documented, right? And everything needs to be standardized. So make sure you have really clear policies for all of these things so that anyone who comes through knows exactly what's going on and you can stay really organized. So going on to sample disposal. So now we have taken the sample, we've analyzed it, we've stored it, we no longer need it, and it can be disposed of. So again, it's the lab's responsibility to ensure that that disposal of all lab waste is handled in a safe manner. So to ensure proper disposal of patient samples, you need to develop a policy for sample disposal and make sure you keep in mind local as well as country regulations for disposal of medical waste. So this can vary from country to country, even region to region maybe. And so it's really important to find out what the local regulations are, where you are, and make sure you're complying with them. And then establish and follow procedures to disinfect samples prior to disposal. So you need to think about once those samples are no longer needed and they're disposed, there's still a process for them to get through before disposal. And you don't want to put anyone else at risk. So the people handling all of the discarded materials, you want to make sure that you're not putting anyone else at risk. So always make sure you follow compliance with local and country regulations to keep everyone as safe as possible. So now we're going to talk a little bit about sample transport. Now, sample transport can take place kind of at a variety of places throughout the process, right? They can be pre-analytical. Maybe their samples are being transported after they're collected. They need to be transported to the lab before they are tested. Or they can be post-analytical. Maybe you are sending the samples after you've tested them, you're sending them somewhere else for long-term storage. So a variety of different places sample transport can come into place. Maybe sometimes samples need to be transported to other labs to do additional testing or referred, things like that. And the distance can really vary too. Sometimes maybe it's just a short car ride, maybe you're putting them on a plane. But regardless, you need to think about the integrity of the sample to make sure that you're not going to lose any sample integrity in the transportation process. So transport has to be managed carefully. Give attention to the temperature, the preservation that may be needed, special transport containers, and time limitations. So it's important to ensure the safety of those handling the material before, during, and after transport. So labs that mail or transport samples by air or sea or train or road between local, regional, or reference labs, or between labs in other countries, have to adhere to a number of regulations. So these regulations are designed to deal with transportation accidents and spills and reduce biohazards and keep samples intact for testing. So where do these transport regulations come from and who develops them? So they come from several sources, some of which include national transport regulations, the International Civil Aviation Organization, or ICAO, as conveyed by the International Air Transport Association, or IATA, rail and road traffic agencies, and postal service. And then also oftentimes private courier companies may have their own regulations and requirements. So compliance with industry standards and regulations is mandatory. Heavy fines may be imposed on personnel who violate these regulations. And that's because you're putting people at risk potentially from the couriers to the air carrier, the lab personnel, passengers, anyone that's handling those samples. And so it's really important to take all of these regulations into consideration. Now, unfortunately, because regulations vary so much from country to country, we don't have time to go into maybe all of the specific nitty-gritty details of all of these things, but you should be able to find out your national regulations and just make sure that you're following their guidance. So this is just an example of packaging requirements. So the United Nations Committee of Experts makes recommendations for the transport of dangerous goods. We're going to talk about the different categories on the next slide. So many countries adopt the UN regulations in their entirety to stand as their national dangerous goods regulations, but some countries apply variations. So national authorities should provide details of their own national requirements. So again, this is going to vary a lot. And so we're not going to spend a whole lot of time on it, just something to be aware of and something that you need to make sure that you're complying with if you are transporting samples. So classification of infectious substances. So sample transport requirements are based on the category of samples being transported. So there are 3 categories. You have category A or category B, and then you have things that are exempt. So those are the 3 categories. So category A are infectious substances capable of causing permanent disability or life-threatening or fatal disease to humans or to humans and animals. And these, they require the most durable triple packaging with full dangerous goods documentations. And it also may require training for transport staff. And then in category B, you have infectious substances that are not in category A. And these have less stringent triple packaging requirements, and they do not require dangerous good documentations. And then finally, you have the exemptions, and these are according to the UN model regulations for the transport of infectious substances. And they have a list of exemptions. And these are samples that have minimal likelihood that pathogens are present, and they don't have the same requirements for packaging as categories A and B. So again, just something to be aware of, and make sure you're following all necessary guidelines for your specific lab and regulations as they apply to your circumstance. So managing sample transport, the kind of overall management is really important, and it ensures that all regulation and requirements are met when transporting samples. It's really important that whoever is doing the managing be aware of national requirements that apply to sample transported. And the personnel who package or who drive transport vehicles should be trained in the proper procedures, both for safety and for good maintenance of samples. So there's kind of 2 intentions here, right? We want to keep everyone safe, and we want to also make sure that any samples that we are transporting are maintained and have good quality whenever they end up at their destination. So specific training may be necessary for people who are doing the packaging or doing the actual transporting. So you need to make sure the samples are protected for temperature. So that can be done, if refrigeration is needed, maybe use a cool box with ice packs. If frozen temperature is necessary, you may need to purchase frozen ice. And also think about the transport time in the packaging. You need to think about the transport time. So if it's going on a 3-day long journey, you're going to need to plan to have enough dry ice that it will last that 3-day long journey. And also think about kind of accidents or what could happen if you're sending samples to a nearby lab and the journey is only meant to take a half an hour or an hour. What if they get stuck in traffic? What if they have a flat tire or something like that? So kind of plan ahead and don't take any risks. Package those samples so that you can be sure that they're going to reach their destination in the appropriate quality. So in summary, the laboratory handbook describes sample collection and provides testing information that must be available to everyone who needs this information. It's important to have a system for tracking samples as they move through the laboratory. You should establish and implement a policy for sample storage and sample disposal, maintain sample integrity and ensure that all regulations and requirements are met, and always, always, always follow universal precautions. And the key takeaways from this presentation is the laboratory must have good samples in order to ensure accuracy and reliability of testing and confidence in results. So sample management directly affects patient care and outcome. So that is the end of the first session, the sample management session. Next, we're going to move on to QC. This is like I said before, it's going to be very brief. We're not going to go into too much detail. And then after this part, we'll break for questions, and then we'll review the case study. So quality control intro, please keep in mind when you're asking questions, you are going to have many more in-depth sessions on this topic. So perhaps save your questions for the following quality control modules. This is really just kind of a brief general overview, and it's going to be very brief, quick. So the learning objectives to define quality control and describe its relationship to the overall quality management system, and describe the differences in quantitative, qualitative, and semi-quantitative examinations. So quality control falls in the same kind of part as sample management. That's process control in the overall quality management system. So what is quality control? Simply put, it's examining control materials for known substances along with patient samples to monitor the accuracy and precision of the complete analytic process. QC is often required for accreditation purposes. So the purpose of QC, or the goal of QC, is to detect errors and correct them before patients' results are reported. So QC monitors activities related to the examination or the analytic phase of testing. So before we talked a lot about the pre and the post analytic phase, and now we're actually talking about the analytical phase in testing, and that is where QC lies. So quality control purposes vary depending on whether the lab examinations use method that produce quantitative, qualitative, or semi-quantitative results. So again, this is going to vary from test to test, from test method to test method. But we're going to just briefly talk about the three types of QC examinations. So first we have quantitative examinations. So this type of QC measures the quantity of an analyte present in the sample. The measurement needs to be accurate and precise. And the measurement provides a numerical value as an endpoint expressed in a particular unit of measurement. So it's really important for QC that you know what units you're looking at. If you're looking at like reference material, making sure that the units of the reference material you're using and the units that you're reporting in are the same. So quantitative measurements, again, anything that has a numeric value as the endpoint. So for example, this would be a lot of your kind of chemistry tests, right? Like blood glucose, sodium, potassium, all of those things that this will use quantitative examinations. And then qualitative examination methods are those that measure the presence or absence of a substance, or evaluate cellular characteristics such as morphology. The results are not expressed in numerical terms, but in terms such as positive or negative, or reactive or non-reactive, or normal or abnormal, or growth or no growth. Examples of qualitative examinations include microscopic examinations, again, if you're looking at kind of the morphology of cells, serologic procedures for the absence or presence of antigens and antibodies, and many biologic procedures. So you see on the examples here, an agar plate, growth or no growth. That can be an example of qualitative examination methods, or a color change. That is a qualitative examination method. And then finally, we have semi-quantitative methods. So these are similar to qualitative examination in that the results are not expressed in quantitative terms, But the difference is that the results of these tests are expressed as an estimate of the measured substance, an estimate of how much of the measured substance is present. So results might be expressed in terms such as trace or moderate or 1+, 2+, 3+. Examples are a urine dipstick, some serologic agglutination procedures, the number of cells per microscopic field, especially if you're looking at ranges, right? So if you're saying 0 to 5 or greater than 20, those are semi-quantitative methods. Titers and dilutions and serological tests are also count. So those are semi-quantitative examinations. So sorry, let me just pull up. Okay, so the QC steps, the steps that the lab is responsible for QC are to establish written policies and procedures, and this needs to include corrective actions. Again, everything needs to be standardized, and you don't want to have a lot of variation between individuals. So always make sure you are making these very clear and include corrective actions and the steps that need to be taken. Train all staff, assure complete documentation, and then review the QC data. So it's not enough to just do the QC, you need to document it. And then it's not enough to just document the QC, it needs to be reviewed, because what's the point of doing the QC if you're not going to review it and actually take steps based on the results? So those are the really important steps of a QC program. And again, this will all be covered in more detail in later sessions. So in summary, QC is an important part of the quality management system. The goal is to identify errors and eliminate them before reporting patient results. And different methods apply for quantitative, qualitative, and semi-quantitative results. Okay, so I think we're going to break here and go through some questions if there are any.
Thanks so much, Kristen, for your excellent presentation. We have several questions. Maybe we can try to get to some of them. And if we don't have enough time, we can see if we can share the answers with the participants later. So the first is it a good practice to log rejected samples and accepted samples in the same logbook?
I would say you certainly can. It might be a good idea to separate those sections out. So maybe you have it's probably best to separate them into different logbooks. So you have one logbook for accepted samples and one logbook for rejected samples. Or what you could do is have kind of a master book where you're putting literally everything that comes through the lab and the time that it is received. And then you have a separate book for when you're actually going through the processing step. And so you can record the samples that have made it to the processing and kind of record the results, and then a separate book for the samples that are rejected. So I would say there's no clear, instructions for that. It's really up to the lab and kind of what flow works best for the number of samples you receive and the types of samples you receive and things like that.
Okay, great. Another person asked, why do we retain a rejected sample?
That's a great question. So I would say there are a couple of reasons. So one is that sometimes you're not sure if sometimes the initial, when you call and speak to the physician, they may initially say, okay, I'll get another sample. They try and maybe they're not able to, and then they may come back and say, you know what, I can't get another sample. I need you to test what you have. I understand that the results may not be accurate, but this is a really, really important test. Maybe the patient is really, really sick, and so I cannot get you another one. I need you to use what we have. And so things can change. And so I would say it's important to save them just in case. Also for training purposes, it can be helpful to kind of have examples of things that were done wrong so that you can use that to inform training policies. And then also, what was the other one? Yeah, I had another response and it just left my mind. But and that's not to say that you need to save rejected samples forever, but maybe, you know, have a policy where you save it for a day, and if after a day it isn't used, or if you received another sample, then it can be discarded. But I just caution from, you know, throwing rejected samples in the bin right off the bat, just in case that you can't actually get another specimen.
Okay, thank you. The next question, are there any standardized international guidelines for sample retention?
That's a good question. Not that I know of. I think, you know, one of the difficulties with lab practices around the world is that there is kind of a lack of standardization, and a lack of organizations that kind of apply to multiple different settings. I would have to default to Dr. Milner or someone who might be able to better answer that question. But if we're not able to get an answer right now, we will find out for you and email you. I don't know if like the ISO or the CLSI or WHO has standards. You could possibly look at those kinds of like international organizations.
Great, thank you. There's a few questions about hemolysis. One is there a simple method for measuring the extent of hemolysis rather than visual inspection? And then another, let me see here. What are some of the tests that we can perform on hemolyzed samples?
Yeah, those are great questions. So I believe I have heard, I think there is a test, a kind of like quantitative test that you can do for hemolysis. I believe it's based on kind of a colorimetric reaction. And so, yes, I do believe there is a type of method that is available out there to get an actual kind of quantitative result. Any lab that I have worked in, it's always just been kind of a grading system. So, you know, slight or severe or markedly or moderately hemolyzed. And then examples of things that can be done on hemolysis. I know typically when we think about hemolysis, we think about kind of chemistry results, right? But there's tons of other types of tests that can be done. So, you know, like a malaria RDT, for example, is fine to do on a hemolyzed sample. So it's really important to read kind of the package inserts or the requirements of the testing method that you're used. And usually they will tell you exactly what types of specimens are reasons for rejection and if hemolysis is included in that.
Okay, and then we have one about how can I monitor temperature of samples during transportation when I don't have a temperature controlled cooler box? Any suggestions there?
Yeah, that's a great question. I have had this situation actually happen in our labs in Kampala. So a couple of options. One, I guess you said okay, so you don't have a temperature monitored box, but one thing you might be able to do is procure an internal temperature probe that can kind of record the temperature of the environment. So it's usually just kind of like a little probe that you stick in and it'll measure the atmosphere, the temperature in the box and kind of record. And then you can look back at those recordings and make sure the temperature didn't fall above a certain temperature. Another thing you can do is take the temperature at the time of packaging. So before the package leaves the lab, take the temperature, and then again take the temperature when the box reaches its destination, take the temperature again. And so as long as you don't have, you know, a huge discrepancy there, or as long as the temperature when it reaches its destination is still within range, you can be moderately sure that it probably, you know, as long as no one was opening the lid and things like that, that can be a way to help assure that it's stayed at a good temperature.
Okay, perfect. I think for sake of time, if you want to continue with the second part, we'll do our best to answer some of these questions, and the rest we'll send to you perhaps for your comment that we can share with the participants later.
Yeah, sure, no problem. And the case review should not take the full hour. So hopefully we will have time for more questions. So
Great.
So here's the scenario that you were sent. I'll just read it aloud. So Mary works at an outpatient clinic as a phlebotomist. It's a very busy day in the clinic, and Mary doesn't have time to label each sample at the time of draw. Instead, she lines the samples up in order of the patient's appointment and saves the labeling until her lunch break. She labels each tube of blood with the patient's name. She writes the tests that are required for each sample on a sheet of paper and gives the samples and the paper to the courier for transport to the lab. The courier places the samples in the front pocket of his backpack and takes them along with the paper to the lab. Upon arrival at the lab, the samples are logged in by John, the medical technologist. John finds a clot in one of the EDTA tubes, pulls the clot out with a stick, and continues processing the sample. 2 of the tests requested on the sample are a full blood count, or FBC, also known as a complete blood count, or CBC, and malaria RDT, or rapid diagnostic test. So that's the scenario. And the questions that I asked you to think about are: list at least 3 mistakes that Mary, the courier, and John have made. Discuss the possible impacts of each of these errors on the test results. Describe how these errors could have been prevented. And then finally, what type of QC, qualitative, quantitative, or semi-quantitative, would be most appropriate for the 2 requested tests? So just to say that there isn't necessarily a right or wrong answer here. This was really just an exercise to kind of get you thinking about some of the things that we talked about. And so I'll just kind of go through and touch on some of the possible answers. I'm sure some of you will have come up with other possibilities. And again, that's not to say that they're right or wrong, just to say that, you know, there are lots of things that you could have taken away from this situation, and I'll just try to touch on the main points. So first, let's talk about the mistakes or errors that were made by Mary, the courier, and John. I'm going to go back to the scenario. So Mary says, it's a busy day at the clinic. I don't have time to label the samples right now. I'm going to line them up and label them on my lunch break. That is a really, really dangerous practice to have. There are so many things. As much as she thinks she's being careful with, you know, lining things up in order, it's especially on a busy day, it's really easy to make a mistake in that regard. Also, you know, what happens if someone comes along and bumps the tray and all of the samples spill on the floor? Now you have tons of unlabeled samples and no way of knowing whose goes with who. So it's really, really good practice and really important to always label samples at time of draw. So labeling should really never be saved until later. We never want to have unlabeled specimens sitting around. So it says she labels each tube of blood with the patient's name. Now, that's good. We want the patient's name, right? But there are maybe a few other things that she could have included. Maybe the date and time of draw, maybe her initials, maybe if the patient's date of birth is known, or some sort of other medical ID, some sort of second patient identifier. That would also be really helpful as well. And then she writes the tests that are required for each sample on a sheet of paper and gives the samples and the paper to the courier for transport to the lab. So again, here, ideally, we don't want to have test requests just on random sheets of paper. In an emergency situation, it sometimes can be acceptable, but in general, there really needs to be a uniform lab requisition that's written. You're gonna need more than just the test, right? There's a lot of other information there that's missing. So in an emergency situation, you may be able to accept it, but for the most part, especially coming from a clinic, there should be a lab rec form there that she can use. So the courier places the samples in the front of his backpack and takes them to the lab with the paper. So here, what we're trying to get at is that's really not a safe way of transporting samples for a number of reasons. Depending on how the courier is getting to the lab, whether it's on a motorbike or a car, you know, if it's on a motorbike, there can be a lot of jostling. And so the samples, the integrity of the sample is really going to be compromised there. Also, what if he gets in an accident on the way to the on the way to the lab on the motorbike and the samples go flying out in the middle of the street? That could be really dangerous, both for, you know, for John, obviously. For other people, you could then have patient information flying around out there. So just putting them in a backpack is really not a very safe way to transport samples. Really, they, at the very least, need to be packaged, you know, in a kind of a cooler box, potentially with some ice packs in there to kind of maintain a cool environment, depending on how warm it is outside. So really taking more time to consider how those samples are being transported would be really helpful there. And then lastly, John finds a clot in one of the EDTA tubes, pulls it out, and continues processing the sample. So again, here, it wouldn't necessarily automatically be cause for rejection. It really depends on what type of test is ordered, and if they're able to get a redraw. So if you're able to get a redraw on a clotted sample, absolutely, that's what that should be done. We all know that there are certain tests that you just cannot run clotted samples on, right? Like CBC, it's just not possible. So that would be an automatic rejection for a CBC. You may be able to do a malaria RDT though, depending on how big the clot is. So maybe some flexibility there, but it's really not good practice to just pull the clot out, toss it, and continue processing the sample. At the very least, there needs to be recognition of the clot. It needs to be recorded so that, you know, down the line, if anyone comes to that sample, they know that it was a clotted sample. So those are the types of things we were looking for that question. So discuss the possible impacts of each of these errors on the test results. So I think I kind of touched on some of them. The really big one for the labeling is just, you know, a mislabeled specimen could have a huge impact on patient outcomes. What if someone had a really low hemoglobin and needed a transfusion, but this, you know, Mary labeled the incorrect tube? So things like mislabels can have a huge impact, not only on the patient, but also, you know, like we talked about, it can lead to a wasting time, delay in results, and retests in the lab, and using up consumables and personnel time. So tons and tons of opportunities for impacts of the mislabel error. The improperly transported sample, depending on kind of the temperature that it was kept at, or how long it took to get to the lab, or if it was a particularly, you know, bumpy ride, maybe it could have gotten hemolyzed. So all of these things can definitely impact tests that are performed. And then the clot, we spoke a little bit about how the possible impact of the clot. Really not an appropriate sample to use for a CBC. I'd say, you know, a lot of tests are going to have to be rejected from a clotted sample, but when possible, especially when you discuss it with the provider, if it's a child or someone that they just cannot get another specimen out of, there may be things that you can do to work around that, but that's going to be a pretty rare circumstance. And then lastly, what type of QC, qualitative, quantitative, or semi-quantitative, would be most appropriate? So the two tests were the CBC or the FBC. So that would be a quantitative QC, so, right? So you want a numerical value for each of the result. And then the malaria RDT, or rapid diagnostic test, that would be a qualitative QC. So you're looking for just a positive or a negative there. So those are the kind of, again, just some examples. I'm sure there could be additional possibilities. And so that was just going over the main points. And yeah, that's all. So yeah, happy to continue with questions or.
Great. Hi, Kristen. We do have a number of additional questions in the Q&A. Let's see, to start, there's one on sample retention. And is there a recommended sample retention time for dry blood spots for HIV early diagnosis, or for any specimen type for that matter?
Oh, I think it would really depend on kind of what you're using it for and kind of your lab policies. I personally don't know of any standardized guidelines for that, to be honest. I think it is kind of up to the lab's, you know, requirements. Not that I know of.
And another question would be, when is the best time to label a sample collection container, before or after sample collection?
Yeah, that's a really good question. To be honest, I have read both in my experience. When I was trained, I was taught after draw at the bedside. So never kind of taking the samples away from the patient's bedside or the patient area. I do think in some circumstances it might be beneficial to actually label it before, at least the name. You want to save the date and time of collection until after they're actually collected, because there can be unexpected delays. But for example, if you're giving a patient a container to actually go and collect the sample themselves, maybe it's a urine or a stool container, you can go ahead and label that with that patient's name, and that way, they can know it's theirs. And so, yeah, it really depends on the situation. I'd say it's good practice to do it kind of at the time of draw. It's going to kind of depend on the procedure. I was trained to do it after the draw, but again, never leaving the patient's bedside. But there may be circumstances where it would be appropriate to just at least do the name beforehand.
Okay, and do we have a standard procedure for rejecting biopsy specimens?
I do not have pathology experience, so I would not be the best person to answer that question, unfortunately. I'm sorry.
We can circle back with Dan and some of the other panelists then on that question.
Sorry, what was the question again? Sorry, I'm in the middle of clinical cases as well. This is Emily.
So there's a question of, is there a standard procedure for rejecting biopsy specimens?
Yeah, so at our institution, we also, so for the pre-processed specimens, so specimens in formalin, we also require 2 patient identifiers. So a name and a date of birth, or a name and another unique identifier like a medical record number. After they've been processed, so tissue blocks that are already embedded in formalin, or sorry, embedded in paraffin, those only require 1 unique patient identifier. Does that answer your question? Hopefully that answers the question.
I hope so.
I forgot there's no participation. Sorry about that.
Okay, so on request forms, is it best to have 1 consolidated form for the lab, or individual forms for individual lab sections?
That's a good question. I would say in general, I mean, in my experience, I've always seen 1 requisition for 1 lab. And so if there are different departments within the lab, you would usually kind of have different sections on the lab requisition, like all the hematology tests would be kind of clustered together, all of the chemistry tests would be clustered together, et cetera. If you're sending the samples to a location and then those are going to be further sent to other labs, sometimes what you can do is kind of have 1 general form for the person collecting the sample to make it really easy for them. And then once it's in the lab, you can actually make additional requisitions if you're having to send that sample out to multiple labs.
Great. So we have a question on the pre-analytical phase, which how effective can it be if the lab is responsible for training clinical staff who collect samples? This may be rather difficult and overwhelming for the lab staff.
Yeah, that's a good question. And I think this also kind of goes into power dynamics, right? Because sometimes it may be uncomfortable to have to, train kind of higher ups like doctors or someone like that. But ultimately, like we talked about, the samples in the lab are really the lab's control. And so I would say that's not to say, okay, so that's not to say that you have to be responsible for training every single new nurse or every single new doctor. That's not necessarily the case. Maybe you hold kind of big training sessions biannually to kind of, have refresher trainings. I mean, I would think the kind of maybe nursing manager or someone like that is going to be doing sample collection training with their employees upon hire, but it's really the lab's responsibility to make sure that the requirements are really clear, and that you're having constant communication. So if you're having trouble with a certain floor or department or anything like that, that you can kind of go to the source and make sure you're communicating those things. Yeah, so that's not to say that every new hire needs to be trained by the lab on sample collection, but just that kind of the overall responsibility of sample collection does fall on the lab. And so they need to make sure that they are providing the resources that the rest of the hospital or clinic or, you know, whatever setting, so that that those resources are available and can be used.
Kristen, this is Dan. If I can pop in for 1 second, I can give two anecdotal examples which may be helpful for answering that question in a realistic or kind of like a real world situation. So in the case of histology samples, which are obviously a little bit more complicated than taking a blood sample, one of the groups that we work with in Rwanda, what they did was they developed a PowerPoint around how to collect the samples, you know, the formalin ratios, how to fill out the requisition form, and made it very clear, like, you know, if these samples aren't collected in this way, they would be rejected. And they actually went around to not all of, but a handful of the labs that were feeding, the sites that were feeding their lab, where they knew there were problems. And then that greatly improved the histology. That's obviously the most direct and difficult, as you are all asking about, way to do that. Is very, very hands-on go when you do that, but it was very effective. The other anecdotal story is in my own experience, we had a problem with a particular very complicated collection of samples around lung biopsies for infectious disease. And we developed a packet, like a way to do that, like a very simple guide for that collection, and gave it to the nurse manager. And then that nurse manager was responsible for training all of the nurses. And then we would look at things that came in to see that training had been done. So both of those are possible. And I think it all gets to what is the problem, how bad is the problem, and how much interaction do you think is needed to solve that problem? But for the most part, as Kristen said, the clinical managers of those teams should be able to handle the training as long as you provide them with the right information and guidance on what that training should look like and what your samples need to look like when they come into the lab.
Thanks. And also, just to add to that, another thing that we did in Kampala was actually make training videos. So I just recorded, just with my cell phone, myself and another lab tech, I recorded him performing. In our case, we were performing a malaria RDT, but you could easily do it for kind of a sample preparation video, and then we distributed that video as like a training tool, and so that can be another kind of tool that you can use. Anything else?
Ken, I think you were going through the Q&A. Were there any more answers to questions that you wanted to ask?
I'm reviewing them now. Okay, so when a lab receives an incomplete lab request form, is it okay for lab staff to complete it or send the request back for proper filling?
That's a very good question. Unfortunately, I think a lot of these responses are going to say it really depends, and as unsatisfactory as that is kind of the case. It depends on how close the collection site is, if it's feasible to send it back. It depends on what information is missing. If it's something that you can still accept it without that information, maybe that's possible. Or if it's a cause for rejection, that probably will be something you wouldn't want to do. But also, it also depends on if you have the contact information for the person that drew the sample, or the attending physician or someone like that. Like, do you have the means to actually contact that person, maybe on the phone, and ask and get clarification? So yeah, unfortunately, I don't know that I have a straightforward answer for that one, but really it would really kind of depend on the situation.
Okay, I think that's about it for the questions. I think the rest we can answer directly in the Q&A.
Great, thanks so much. Again, Kristen, thank you so much for presenting this topic. I think it was really informative and very useful as the first of 3 sessions on process control. I believe the next 2 are also on process control. So thank you all for who asked questions. We do capture all of the questions. So if those are, if we want to, we can continue to provide answers for those, even if it's offline or after the recording. And please don't forget, you will be receiving the registration link on Sunday for the Tuesday's coming session. And then on Tuesday, you'll receive the registration link for the Thursday session. It's very important that you look for that email because it has the case in it, as well as the link. The link, as you know, is on the landing page. You can see that anytime and go register 48 hours before the session. But the email will have the case that's going to be discussed. So it's important to do that. Again, thanks everyone so much. Thanks for Emily, Debbie, and Ken for monitoring the Q&A during this session. And we hope to see all of you on Tuesday. One thing, there was a question about PowerPoint presentations. So the core PowerPoint presentations that we're using for this course are on the WHO website under the QMS course. We're modifying those as was requested and is required to be compliant with the 2012 ISO 15189 language. So the basic set is on the WHO website, but what you will be presented is going to have those updates in them. And in addition to that, the recordings that we have that are live for you to watch, are available for you to watch after the session, will have all the PowerPoint slides, and you can obviously pause if you need to look at the slide for longer or take a screen capture. So with that, I think we will conclude. And again, we will see you all on this coming Tuesday. Bye-bye.